on this episode of The Natural Plastic Surgeon. At your highest, like what would be the highest?
It was about 400 pills per month, and it was the highest. I was on oxycodone 30, and so I'd get 90 of those.
Oh my God.
And then I would get 10, Percocet 10, 3, 25. I wanted to make sure it was the less amount of acetaminophen.
A lot of other countries it's downright illegal. You can actually go to jail if you have CBD in your possession. It comes from a natural plant. It does not get you high. Oh, I have thyroid disease. I'm taking Synthroid. I'm like, okay, so you're taking a medication, but did you ever figure out why did you have Hashimoto's thyroiditis? Why is your body attacking your thyroid? Or why is your body attacking your pancreas and causing diabetes? Why is your body attacking your skin and causing psoriasis? Why is your body attacking your gut? We have a patient of mine, Chanel, who's on the show. Have you ever been on a podcast before?
I've never done one, but I facilitated them before.
Okay.
Yes.
Amazing. Well, I'm excited to have you on the show.
I'm so excited to be here.
Yes. We were just chatting and after your surgery and everything, and we were just talking about a lot of the stuff that I'm doing and very few other people are doing for post-surgical healing that has really benefited you. In terms of your healing and post-op, and you have a great background that I want to dive into as well with some of your own product line. And let's just talk about. Can we talk about the surgery that we did?
Of course.
Okay.
Of course.
So Chanel came to me, I think it was over 9 months ago because you're 9 months out from surgery, and you were kind of unhappy about the appearance of your breasts, and we also have some sternal abnormalities. And I believe it was pectus excavatum, right?
Yes, it was.
Which,
yes.
if you guys don't know what that is, that's where the chest is a little bit concave in the middle. And I would say you have a very mild version of that.
Yes.
Overall, when you came to me, you were a very beautiful woman. You still are a very beautiful woman. But I saw some of the things that were kind of concerning to you.
Absolutely.
And we decided to do fat grafting to the breast and also to the sternum area. We also did a slight reduction to kind of allow some greater symmetry for the breast and a little bit of a lift as well. Tell us briefly how you're doing now.
Amazing. It's been something that has completely changed my life for the better. I notice in all ways how much more confident I feel within my being. I don't feel as insecure, even just in my relationships. With all people,
yes,
but specifically with myself, I can look in the mirror and feel like this is who I was meant to be and this is who I truly am. So it's been life-changing.
Like what I learned in residency, I went to a great residency program. I went to a great medical school.
Yes.
These are all top-notch places. I studied really hard. I did well on all the tests. I did well on my boards. And they don't teach a lot about some of the stuff that I'm doing now.
Yeah.
Which is kind of unfortunate. There's a pharmaceutical solution for everything, but a lot of those pharmaceutical solutions are not the best.
Absolutely.
And I recognized that early on. It's like a patient's having pain. Oh, you prescribe opioids,
yes.
right? Okay. Well, is that always the best thing to do? And it's like, I don't think it is. And it's basically masking pain versus like getting to the root cause of the pain, helping with inflammation. There's so many other modalities out there, so many other options, which we're going to get into. And so when you were thinking about having the surgery, did any of that pop into your head? Did you know that I do any of these other type of alternative things? Tell us about that.
Yeah.
Let's rewind and let's start back then.
Yeah. So I was really drawn just based off of your name, like the Natural Plastic Surgeon.
Okay.
Because for me, I try to do things more holistically. And just for I want to use natural products a part of my body.
Yeah.
And I really saw what your pre-op care was. And that was really something that I was drawn to, especially with all your education that you put on YouTube. That for me was really created a sense of safety. I felt actually safe with you.
Okay.
Because I don't feel personally safe with doctors that prescribe Valium prior to procedure. There's nothing wrong with it. Like, I get that it's from a textbook perspective.
Right.
But as far as for what's going to be a healing solution for the patient prior and post-op, for me, it was something that I really focus on is making sure that it's done with natural intention. And something from a pharmaceutical that's going to kind of take away the natural nerves that we need, in order to actually heal. Like all
Well,
of it is a part of it.
that is critical, but then also what drives me insane is what's the big picture here? Like, am I treating this person in just this limited window of time? Because if that's the case, maybe Valium's okay. But the problem with Valium, the problem with Ativan is it creates rebound,
Yeah,
right?
the side effects.
The same thing with opioids. It creates addiction. So it's like, I don't want someone to come in here, feel fine for the surgery, but then I'm wrecking them for 6 to 9 weeks later, and then, oh, okay, it's not my problem anymore. I don't feel good about that.
And I appreciate you for that, because you truly care about the patient as a whole. I think that's where, that safety aspect came through.
Yeah.
Because I've been in positions where doctors maybe don't think long term. And I've been, as we're going to get into later, but I've been heavily addicted to opioids. And so it was a huge factor for me.
Well, let's dive into that.
Okay.
Yeah, let's
Yeah.
just go down that rabbit hole and tell us a
course.
little bit more about yourself, and because I think that's going to help the listener understand
Yes.
why you were actually
My
thinking
perspective.
about it. Yeah.
So I had been heavily addicted to opioids for about 7 years or so of my life. It progressively got worse. I was prescribed hydrocodone as my first dose of, an opioid.
Okay.
And I think that's pretty common for most people.
What were you prescribed that for?
So I was prescribed actually for an issue to my sternum.
Okay.
And I was anorexic at the time.
Mm-hmm.
And so when I took my first dose of opioids, it took away the pain that I was experiencing in all ways, emotional, physical, right? It was an illusion of taking it away. And I remember even the doctor telling me when she gave me, my first prescription, she said, this is also going to help with your anxiety, that I was experiencing. Because she knew I was anorexic. I told her. You could tell just how thin I was as well. But I was going through a lot of emotional issues. And that for me was something that I was seeking, right? I was seeking something to take away my pain. I was seeking, something that I felt I couldn't give to myself at the time because I was really seeking externally for something. And so I started relying upon it in high school to start taking away not only my physical pain from cross country and track, but also the emotional issues that were unhealed. My childhood trauma and things that I didn't know. It was unconscious. But I feel that it's a common theme for a lot of people that they get on Vicodin, which that's hydrocodone, as their first dose of, opioids. And then it just progressively got worse for me. I went into my teens because that was something that already I knew would take something away for me. It would take away pain, the illusion of taking away pain. So I started going towards that as my numbing agent when I went into my early 20s. I had several spinal procedures. I had a microdiscectomy. I had an A-lift. And I was very young at the time. I had my spinal fusion. That's what an A-lift is, anterior lumbar interbody fusion. At 22 years old, I literally woke up on my 22nd birthday to go to get my spinal fusion. And I then went into, please go ahead.
Was that necessary? No. Was that surgery, looking back, was that surgery necessary? Do you feel like that? Were you having a lot of back pain? Was there something physically wrong with your back?
Yeah, I mean, I did have a fracture at L5S1.
Okay.
And I did have actual neuropathy coupled with I lost motor function in my right leg.
So that's a real deal.
It was a real deal, but it was also accentuated, and this is what I try to also help people from my story.
Yeah.
The accentuated chronic pain was due to the emotional issues.
Okay.
Right? And kind of then being in this mental reward system of almost being addicted to being chronic. Okay. Because then I started to become addicted to the label. And I think that's important for people. It's not to self-blame, but it's also to recognize that we can use these labels as crutches. And that's what I started to do because my life at the time, my personal life, was really in the shit, in the shambles.
Yeah.
And it, for me, I was heavily also addicted to the party scene. I was addicted in my relationships. It was my lifestyle that I was living that really was contributing also to, this whole unhealthy approach to just even life in general. So the crutch became also chronic pain. And it's very important to me, though, to share that, there was so much light underneath that. I just had to allow myself to connect to it. So a lot of hope for people. You just kind of have to clear out that negativity that you find yourself in order to get, like you were saying, it's more of the roots, right? Well, how do these things manifest themselves? And how do they manifest to that level of accentuated pain, to where that level 10 pain, where you're just automatically programmed, you've programmed yourself to be at a level 10. And this isn't to also diminish what people go through. There's many different kinds of conditions.
Yeah.
I'm just saying personally what I experienced, I was, using that as a crutch.
So now we're heavily into addicted. So if you don't have them, you feel even worse.
Yes.
And how are you getting a hold of these medications?
So I was in a pain management program.
Okay.
And I also knew that because I was at the time getting from a primary care physician, and she told me, I can't keep giving you these large amounts, because she was giving me large amounts. And so she directed me towards.
Can you tell, like at your highest, like what would be
my highest?
Yeah, highest amount of narcotics.
It was about 400 pills per month, and it was the highest. I was on oxycodone 30. And so I'd get 90 of those.
Oh my God.
And then I would get 10, Percocet 10-3-25. I wanted to make sure it was the less amount of acetaminophen, because I was a smart addict.
10-3-25.
10-3-25, the highest Percocet you can get. I don't know if it's still the highest, but back then it was.
Yeah.
It was, I'd get 280 of that, or 3, whatever. I think it was
300 of those a month?
280. I'd get 280, plus I'd get 90 of the oxycodone 30.
Oh my gosh. That's like 20 pills a day.
Oh, I was taking, and then I would overtake, because that's the thing, right? I mean, you become so physically addicted that's the one thing about opioids I find very interesting.
Just to catch people up, if a person who's never had opioids took a daily dose of what Chanel was taking, they would die.
Yeah,
they would die.
Yeah, they would die. So please,
know.
don't do what I did.
Yeah,
that's the big thing. Don't do what I did.
Right.
I was heavily addicted, and I also started supplementing outside of that what I was given. And I was taking also Dilaudid at the time.
Oral.
And I actually would inject it. I started injecting.
Intramuscular.
I would actually do it through my anus.
Okay.
I was too afraid to do it IV.
Okay.
I always thought I was too chicken, to do it IV.
Wow.
So I started doing it in my anus. That was after my dad transitioned. My dad passed away from stage 4 esophageal cancer. And he was my best friend. And that for me was a big trauma. So I was already addicted to opioids, and then it just, went even more.
Gosh.
Yeah. So for me, Dr. Barrett, it's very important to educate people, what is actually out there, because I don't think a lot of people even think it's real, that this is going on. That's really what I was prescribed per month from one doctor. I signed one doctor, one pharmacy in pain management, so I thought I was good to go. Yeah. And pretty much you were. Like I was back then, I was good to go. I could get that much, and, nobody say anything.
Wow. Yeah. Is that still possible today?
I don't know. Yeah. I mean, I'm not in the game. I'm not in it anymore. I'm not in the game anymore.
I know. It's crazy. There are a lot of legislation. They are tracking. There's a database now that kind of tracks, and I'll get a notification that I'll have a patient that I'll sometimes prescribe just a normal. I still prescribe some opioids for surgeries. It's a very small amount because some people still need it. It's reasonable. They have had surgery. I generally tell people don't take them unless you absolutely need to take them, and the majority of my patients don't need to take them. But sometimes every now and then I'll get somebody that it triggers an alert, and it says, by the way, this person also is getting narcotics from this other doctor. And so they are kind of catching on to some of that stuff. Good. So
I love hearing it.
I like to think that there's still a role for opioids, and I don't fully understand it. It's not my specialty. Yeah. So again, I'm not trying to stop people that really need it for certain whatever issues from getting it. But there's other options for a lot of people.
Definitely. Well, and the side effects, like you were saying earlier, the downside, I can share from personal experience of obviously being heavily addicted.
Right.
I would have to go to the hospital because of the level of constipation.
Yes.
Because I wouldn't take a bowel movement for about almost a month. Yeah. And it was to the point where then my ovaries, I was having issues. I had 2 laparoscopies also. And so I was having ovarian issues as well. Yeah. And the constipation didn't help, right? Then the pain would become even worse. No. Yeah. And so that was also a factor. Yeah. Right. And then when I'd go in, because I at the time couldn't admit to myself that I was so addicted, I was withdrawing because I would take overprescribed, And then I would go to the hospital because I needed re-up,
Yeah.
because then I didn't have anything in between, and I'm withdrawing very heavily.
Wow.
And so that was the cycle I was living in, was just, okay, I, live in this tuned out reality. And like I said, I really actually did have pain. That's the sad part of it. There was really pain.
Mm-hmm.
But then I'm trying to reiterate that accentuation where it's every day, the programming, oh, I'm just a level 10, I'm chronic. There was a lot of debugging that needed to kind of come into play for me.
It's interesting you mentioned the constipation. Early on when I started my career as a plastic surgeon here in Beverly Hills, I would just do the regular prescription for my patients that we are all taught in residency, 30 of Norcos. And my patients, especially like after a tummy tuck, which is a bigger operation, they'd be in a lot of pain. They'd take the Norcos. They would start taking them around the clock, and whether they needed them or not, and that's kind of what the nurses would do. And if they go to an aftercare facility, the nurse is like, time for your pain pill, time for your pain pill.
Yes, exactly.
And it would just start feeding them. And I noticed early on that these patients who were taking them around the clock, used all 30 or even more, they didn't recover as fast and as well. They would come in, they would be kind of diaphoretic, they would kind of be groggy, they'd be out of it, sometimes nauseous, constantly, definite constipation. If you ever had a tummy tuck, that's not fun.
Yeah. It doesn't sound fun. Yeah.
Right, because the plication you do for your core and then didn't have constipation, it was a disaster. Or if they'd end up throwing up because they're nauseous, their appetite would be non-existent, which is a horrible thing because you need food and nutrition to heal after a major operation, especially like a tummy tuck. I'm basically cutting people in half. And so I was like, God, there's got to be a better way to do this. So one of the first things that came out was called Exparel, and that's a long-acting local pain medication. I don't think we used it for your operation because
I think we may have.
Did we?
Yeah, I think we did. Yeah,
okay,
it actually
good.
did really help me.
Okay, good.
It did really help me.
Okay.
And I was grateful for it. Yeah.
Good. Well, I'm glad.
Yeah, I did get it. Yeah.
Well, I use it for a lot of operations, especially tummy tuck. We inject it in the most painful parts, and it provides pain relief for 3 days. So what I've noticed is the Exparel patients, I learned this from the orthopedic surgeons who are injecting it in joints and everything else. And I was like, why aren't we doing this plastic surgery? Why aren't we doing this in all the surgeries?
Yeah, it was amazing for me. I loved it.
Yeah. And so I
worked.
use it for any patient that wants to use it. If anything, I'll use Marcaine, which at least lasts 6 hours. I started learning techniques from anesthesiologists, pre-injection numbing medicine, so we don't upregulate the pain system in people's bodies, right? Like anesthesia will put your mind to sleep, but it doesn't put your body to sleep. So if you were under anesthesia and I made an incision on your body, your body cells, local nerves will feel that, and your spinal cord will feel that. And they're like, uh-oh, trauma. Wow. All of a sudden it upregulates your pain fibers. So it's like if you got a splinter in your finger, it wouldn't hurt right away, but then it starts to hurt like a few days later. Have you ever seen that where it gets red, all some more painful?
Pain signals,
That's upregulation of your nerves.
Wow.
And so we learn those techniques, like, okay, let's start pre-injecting numbing medicine on all of our incisions, the whole areas, as long as it's safe. And then we noticed that our patients, instead of taking 2 weeks to recover from a breast augmentation, would only take them 3 days.
Wow.
Yeah. So
That's amazing.
Yeah, and then we started adding, and I started looking into CBD. Actually, before that, I started using magnesium, which relaxes muscles. We don't get enough magnesium in our diet. I started looking at even things you can do pre-surgery, like cold showers. You
recommended it to me, and it was huge. I mean, I loved it. It really did work. It worked.
Yeah. So
I was grateful for that.
Anyway, so I think you caught me pretty much when we're really getting into some of this 9 months ago. Really get into a lot of those things, and tell us. All right. So how did you find out that I actually did some of that? Was that how you picked me, or what did you, what fell into how you found me? Or did we find that out later?
I found you on YouTube.
Okay.
And really what drew me in was the natural plastic surgeon, as far as your podcast.
Yes.
And just your name really resonated with what I'm seeking. And I did see that you actually prescribed CBD as a form of your recovery. Yeah. And that was huge because I hadn't seen that with any other doctor. And that was huge for me, is because that's what I used to help me heal from my opioid addiction, was also cannabis.
So so how did you come clean from opioids? Do you still use opioids at all now?
No.
Okay.
Been completely clean for 6 years.
You were taking like 20, 30 pills a day.
Yeah, like 30. Yeah.
And now you don't take anything. So this is really, we got to get into this. So how did you do this? Because I mean, you
Yeah.
seem like an amazing person, and
Thanks,
it's just like I
thanks.
can't imagine that you went through that and you had such a horrible addiction, and now you're like this outstanding, bright, amazing individual
Oh,
with your own product line here.
thanks, Dr. Barrett.
Yeah.
You're beautiful.
Well,
Yeah, I mean, really, it was just, gosh, I have David here sitting on the side. He's my partner.
yes, we have David in the room.
Yes, he was a big part of also me getting clean.
Okay.
He facilitated space for me through love and understanding, which really helped me heal. And we were talking about safety earlier.
Yeah.
Really feeling safe with someone, you're able to let go, right? You're able to heal.
Mm-hmm.
And there's many different ways to feel safe with someone. And with David, it helped me realize that there were other humans that would really love me for just being me.
Mm-hmm.
And that helped me to also love myself more. And just having that support, but also really, gosh, I mean, there's a lot, Dr. Barrett, with that. Just having a near-death experience. I had a near-death experience.
Was that because of opioids?
Yes.
Okay.
I've overdosed and went to what I would like to call the waiting room. And it was with my dad, who had just transitioned. And he basically looked me in the eyes, his soul.
So
Yeah.
he'd already passed from the living
Yeah.
world, and how long ago was this?
It was about a month.
A month after your dad physically passed.
Yes.
Okay.
And he basically let me know, like with lessons that, I reflected with the lessons later, that he would not do it for me and he could not do it for me. And that this was a self-created illness, meaning like inner self, as far as choice. Like there was a choice that I was making each day to use drugs.
Yeah.
And that was huge for me, just like empowerment. And that woke me up. Like when I came back into this reality, I remember screaming as loud as I could. I felt my soul come back into my body.
Oh my God.
And my heart, the whole thing. And I just remember screaming and just being so happy to be alive.
Yeah.
And I knew that in that moment, everything was going to change.
How did you know it was a near-death experience? Was anybody witnessing this, or
No, I was alone in my apartment.
Okay.
But I just know by the way that I felt.
Yeah, that was you got close. It was
because I felt my soul come in and out.
Yeah.
And I know that I went into because I set this is why, because I set the intention that day to die. So I set that intention that day to overdose. So I was taking 6 at a time pills.
Yeah.
And, for anyone, it's not trigger alert, but just, I would set the intention that day that I wanted to die.
God.
And I don't even know how many I took that day.
Yeah.
But I know at least from what I know with my body, I feel like I went into cardiac arrest and, went cold.
And that feeling normally never happens when you were just on a regular day.
No, because I could resuscitate myself. I knew how to resuscitate myself to a certain degree.
Yeah.
I just lived in that cycle. Like it would come to a point and I would just start hitting my chest because I could feel, myself starting to go, like my breathing would start to, get depressed.
Yeah.
My heart would start to slow. And I knew how to like basically hit my chest in a way where, okay, I feel my heart come back into like, this existence. This is like, I was watching Euphoria the other day and like just kind of resonated with what the storyline a little bit, because I went through similar experiences.
Mm. Okay.
Yeah.
So you woke up, screamed, and you're like, something's got to change.
Yeah, from that point on, I mean, I could feel it on a soul level, where I was just like, if I don't do this, if I really don't put any effort into this, I will fully, transition next time.
Yeah.
And I wanted to be alive, and I actually really wanted to just have a good life.
Yeah.
I didn't want to keep living the life that I was. And so that was really big for me, knowing that no one's going to come save me. I got to save myself. And the relationship I was in at the time with my prior ex, he wasn't supportive. So I knew that I had to do it myself.
Was he enabling the drug usage?
Yeah, I mean, you could say that to a certain degree. I think there was parts of him I sent love to him. I think there was parts that enjoyed me on drugs to a certain degree.
Okay.
Sent him love, but yeah, he got to do certain things, and that's okay. That's where we were at the time. We were together for 7 years, and just went through a lot of life together. But yeah, it just became so unhealthy at that point.
Okay.
Yeah, and so there was some enabling. He had his own, addictions. I think you kind of have to when you're in that sort of situation, to have your partner that high. There's parts of you that are obviously doing things as well to allow it. So, and not in all cases, but in our case, that was what happened.
Got it. And how did you, okay, so steps to doing this, you've made the mental resolve, but you've got this massive addiction in your body now to
Yes.
opioids. So how did you
Yes.
get there?
So for me, I knew I actually had to go to Hoag Hospital the first couple nights that I, was choosing to withdraw because of dehydration and some other factors. And I chose to go cold turkey. I would not recommend that for anyone.
Oh God.
I went cold turkey.
Yeah.
I did choose to use cannabis though.
Yeah.
That really helped me. So this is where CBD comes through.
Okay.
This is where Rick Simpson oil. I actually took Rick Simpson oil.
What's Rick Simpson oil?
So Rick Simpson oil is a high THC concentrate.
Okay.
And my father actually used it when he had cancer.
Yeah.
And that's where it inspired me to use it in my own life because I saw how much it helped him. So that's what I used. In conjunction with also, I took a low dose of gabapentin for a little bit. But after that...
Was there any medical supervision of this? Was at Hoag or no?
At Hoag, they just basically gave me a patch to regulate my heartbeat.
Okay.
And they just said, because I finally admitted to them, hey, I'm having an opioid withdrawal, which was huge because before I wouldn't admit it.
Yeah.
And they basically sent me on the way with just my little heart patch to make sure, hey, you're going to need to stay hydrated. They gave me IV fluids.
It's actually not life-threatening for opioid.
Yeah.
It is for other addictions, like alcohol. It can actually be life-threatening.
Yes, and Xanax too.
Yeah, the barbiturates and benzos. Yes. So, but the one of the harshest things that can happen, though, it doesn't. You can't die from it, but it's probably one of the most uncomfortable things is opioid withdrawal.
Yeah. It was really, I have to say, though, beautiful. If you can use it as an opportunity, it was very intense, but if you can use it as an opportunity, I saw it as like, okay, I'm not going to use Suboxone because I was offered Suboxone. Didn't want to do it because, Suboxone is just another narcotic for me. I knew that if I got on that, I'd probably get addicted to it too.
Yeah.
And so I chose to use cannabis. So, going back to that. But I saw it as a beautiful blessing to be able to purge out all my old life. So kind of like what people use ayahuasca for, these plant medicines. I saw it as an opportunity then to purge out, my old life. Because you're already going to be vomiting and, having diarrhea and... you're already going to have that. And that's the part that I think people are very afraid of is to withdraw because it is very intense. But it's also can be like a blessing if you look at it that way because it's just, it's temporary. Like you said, you're not going to die, like most likely, if you have the right fluids and the right person and the right, environment, you're not going to die. So if you have that in the back of your mind, I mean, for me though, I was at the point where I was already dying, like the life I was living. I was just existing. So for me, it felt like, I didn't even care at that point. Like for me, I was so, had such a conviction that I don't even care if I die because then I'll at least be sober. I can say I tried. Yeah. So it's just a perspective shift, and I think that's really big for people who are about to make any leaps or, especially coming off of that type of substance.
How many days did it take you to get off, feel back to normal, if that could be a possibility?
I think, for me, I realistically felt like I withdrawed for, it was about 30 days or so. But I'm going to say, like, on my whole, like, level cellularly, I felt like it took me, like, 6 months. But, 30 days for me, like, really feeling it, like, the acute. I would say more acute. Yeah. But everybody's different. Like I said, I was a heavier user. Yeah. So... for me, 30 days was like I was, still really feeling it.
I mean, you were on for so long, you did so much. I mean, it probably affected even every cell down to the DNA.
Yeah.
And that takes a long time.
It does. And that's why I felt like I would drop for like 6 months. I mean, I felt, and, but it was okay. Like I knew when it would kick in, okay. I would just make light of it. I was like, all right, the withdrawals are kicking in again. I mean, people.
That's crazy, Chanel. That is crazy. I can't like you.
And I tell dude, I go, okay, it's kicking in again. So I'm gonna feel a little nauseous. I'm gonna feel a little bit, a little uneasy, a little. But I didn't, for me, Dr. Barrett, it was like I was so grateful to be alive. I was so grateful, I was so grateful that I had this beautiful life ahead of me. So to me, it's like my spinal fusion. Like I still kind of get pain here and there today, but that's like normal. Like I have my life back.
So. Besides CBD, what else did you do? Because you have some serious kind of like pain concerns. And I'm not trying to label it as that, but it sounds like there's still some things in your body that are causing pain. So what are some other things that you've done besides CBD and THC to help with that?
So, physical exercise is huge.
Yeah.
And I know that you're huge.
Yeah. So, all right. So not just not just certain pill, but like some lifestyle things that, and a lot of people don't realize that exercise daily is like one of the best things you could do for a lot of things, including chronic pain.
Yes.
Yeah.
For me, the bike is huge.
Cool.
I love the bike. I found out I'm like a little indoor cyclist after I started getting my life together.
Is that like Peloton or like on a
kind
train?
of? Yeah, I like to do like indoor cycling classes.
Okay.
I found a hobby, and diet is big. Nutrition, limiting sugar. It's definitely anything that's going to help with inflammation, and the people I associated with. We can take on other people's energy. I really believe in energy, and I just think that. The people we associate with are also reflections of parts of us that need just kind of to be healthier. Yeah. And I noticed that the lifestyle that I was living with them, very unhealthy. Just the drinking too, not even the opioids, but drinking, smoking. There's many things that I chose also that were contributing to the pain. Emotionally, too. So
lifestyle. Interpersonal relationships.
Yes.
Definitely some THC, CBD, any other type of products. I mean, tell us about
hydration too is important.
Okay. Tell us about you decided to come up with a product line your own, and can we talk about it for just?
Please.
Okay. So it is Fusion Wellness. Can you tell? And so this 50 milligram CBD bath bomb. Hell yeah.
Yeah.
I didn't know you had this. Can I buy this from you?
Oh, of course. You can have it for free.
Are you sure?
You can have it for free. You gave me the beautiful
crap.
tincture.
I'll trade. This is awesome. It's like sometimes I'll do a big race. I'll do like a triathlon or something. And
I
I'm
think
just
this will really help you.
Oh, I'm just like wrecked.
Do you take salt baths?
Yeah, I'll do like a magnesium bath, but I didn't know you could actually do a CBD bath bomb.
Oh,
they
really help.
And frankincense.
And that was also what I would use for withdrawals.
Okay.
Is salt baths. So salt baths really will help with the muscle aches and cramps and whatnot.
Okay.
So if you're and also just helps emotionally too, but it will help with the muscle aches.
This is fantastic. You've got some really quality ingredients here. Himalayan salt crystals, which is better form of salt, organic fractionated coconut. So it's like that stuff's not cheap, No,
we actually, and Dead Sea salt, so these are all, for us, it's really choosing, the ingredients were important to the brand.
Yeah.
Because there is different salts from different regions where you're going to get like different energy, different mineral content. And people forget about that. It's not just Epsom salt.
Yeah.
There's also different forms of salt that will help your body because there's trace minerals.
Yeah.
From each different region.
I've been using Redmond salt to eat with. Is that any good? If it's from Utah? I don't know.
I don't specifically know the one you're talking about.
Yeah, it's supposed to come from like some salt mines in Utah. Which
Okay, I'll have to check it out. Yeah, I'll have to check it out.
All right.
I love salt. I mean, it can really do wonders too. I mean, it's universal. It is universal.
Well, tell us your. When did you start this product line? And tell us about your products and like what do people use these for?
So I started Fusion Wellness in 2018.
Okay. Do you have a website?
Yes, I do. It's www.fusionwellness.shop.
.shop? .shop.
Yes.
Okay. www.fusionwellness.shop.
Yes.
And then do you have an Instagram?
I do.
Okay.
It's fusion_wellness _co.
Do I follow you yet?
I think you do.
Okay.
I think you do.
Okay.
Yeah, and it's really focused just on, like we were talking about, treating the person as a whole. We all have different addictions in different forms, I believe. So it's really kind of just having a more loving and understanding approach towards ourselves and like as a society. So this isn't just about, CBD products. It's about the message.
Fusion Wellness. So Fusion_wellness _co. Yeah,
yes.
Cool. All right.
Cool.
I'm on it.
Awesome.
Okay.
Thank you. Thank you.
And so you came up with this product line.
Yes.
And it's overall wellness or any specific group of people that want these products?
I think it's honestly for everyone.
Okay.
Everyone needs self-care.
Yeah.
It's mainly self-care. We all forget, like life becomes, really hectic and challenging for everyone. If you're here on this planet, you're going to go through a challenge. That's just a part of being human. And we all have different forms of, like I was saying, like kind of addictions, I believe. Now, that's not to say that, you have an addiction, like as far as like, it's just a lot of times we find ourselves into positions that we wouldn't normally find ourselves in if we had some type of outlet, right? Like we need to take care of ourselves. We need some type of hobby. We need something outside of what we're currently doing, like in our work environment, in our relationships. Like you need something for yourself that's actually going to clear your mind, body, and soul. And so this is why we created these products, so you can really focus on yourself. From my own story, that's what I learned. It's
Yeah.
light and dark aspects.
I know. I'm so tired of like
Uh-huh.
finding stuff that's just like basic, cost-driven stuff. Like
Yeah.
I pick out
Uh-huh.
like organic food,
Yes.
for myself, and
Yes.
I'm so particular. You can ask my staff. Like
Mm-hmm.
I don't eat sugar.
It's
Although
good.
yesterday I broke down. I had a piece of cake that my
Okay.
patient
Well,
brought me.
yeah.
But
There's,
it's just
it's like
like I had to
sometimes
do
that's
it.
okay though. Sometimes
Yeah.
that's okay.
Yeah.
Things in moderation are okay, but you start noticing like, is it starting to become like a really unhealthy habit?
Right.
Then yeah, you evaluate it.
Yeah.
But like you said, I mean, it's good to be particular, and it's good to like know what your body needs. Like I think that's common too. People don't
Yeah.
know fully what they need.
Yeah. Well,
So.
CBD, I do want to spend just a minute on that.
Mm-hmm.
It's one of those things that is countercurrent.
Mm-hmm.
California is very progressive about it.
Mm-hmm.
I wouldn't say very progressive, but I would just say moderately progressive about it. And a lot of other states are not. A lot of other countries are. It's downright illegal. You can actually go to jail if you have CBD in your possession. It comes from a natural plant. It does not get you high. THC can get you high.
Yes.
CBD has incredible medicinal properties. It works where I actually, previous podcast way back when, within the first season last year, I had Makers of Wild Health CBD. This is when I first started doing my research about CBD. And that was the product I recommended before I developed my own, which both are good, but my product, I've actually made it a little bit better.
Wow. And I love your product, by the way.
Thank you.
I think your product's amazing.
Yes.
And I don't just say that because you gave it to me. I really mean it.
Okay.
I really mean it.
Yeah.
You've created something very special. It has those terpenes, which I know
Yes.
you really were focusing on.
Right.
That terpene profile for specific uses, which really for me, I found it did its purpose.
Yeah.
Really good for pain, really good for sleep.
Yeah.
And we know our stuff as far as, CBD.
Well, good.
So
I'm glad to hear that. We actually had another patient who tests quality of CBD.
Okay.
And
Yes.
she does spectrum analysis. She checks for
wow.
pesticides.
Okay,
She checks for all this
yeah.
other stuff. She tested our product and it was like,
Yeah.
it was perfectly clean and very good concentration. It had actually some CBG in it, which is this kind of this
okay.
newer kind of, that's the idea of this full spectrum of
Yes.
CBD, which you get kind of this synergistic effect of some of the CBDs in there, which we fully don't quite understand yet, but we're working on it. But what we know about CBD in general is that it works on CB1 and CB2 receptors. CB1 is generally responsible for anxiety in our bodies, and CB2 is can be responsible for pain. And CBD works in an amazing way that is non-addicting. That's what's so incredible about it, is that it knocks the pain down and knocks down anxiety, but it doesn't get you addicted to it. So if you stop using it, you don't feel worse right after. And it's like, why is nobody talking about this?
Yeah, I know. It's interesting to me
Well,
that
people
we're
are,
still,
but why aren't more people talking about it? Why aren't we talking about this for all surgeries versus narcotics, opioids?
I think it's a lack of education, and I also think it's people's belief systems. We have to. That's why "Allow Healing" was big for us as a slogan.
Yeah. Oh, allow healing is your
Allow
slogan.
healing, yes.
Great.
Because you also need to break certain belief systems within yourself, because not only culturally, we've been programmed with, cannabis, I think, right? There's, depending on what time you were born also, you have certain programming towards the plant.
Yeah.
And so you kind of have to, navigate it. You're unlearning and learning. And I think that's really what creates this resistance towards using CBD as the medicine.
Yeah.
It's just kind of people's belief systems and a lack of education. And
do you think it's, I think that's a big contributor, but do you also think it's a pharmaceutical influence in terms of lobbying and profit margins and shareholders trying to keep something out that might actually work better than the products that they already have patents on?
Yes. Yeah, it's a business. Yeah.
Yes.
Yeah.
Wait, we don't want to show up on the radar of the FDA.
Yeah.
It's
well,
like,
it's a business. Yeah.
Right. I know.
And that's the thing. I mean, it was kind of like when my dad had cancer.
Yeah.
Observing that, and anyone who's going through cancer who's listening right now, I send you love, because it's a very intense experience. But it's interesting, keeping people sick, is really how
I know.
you create a business.
Yeah.
So just keeping that in mind when, you're being pushed pharmaceuticals that you wouldn't actually want to take.
Right.
Just remind yourself that people are making their money from you
Yes,
being
remind
sick.
yourself of that, and then
Mm-hmm.
understand the root cause of what's going on in your body. So I get a lot of patients that come in and they're like, "Oh, I have thyroid disease. I'm taking Synthroid." I'm like, "Okay, so you're taking a medication, but did you ever figure out why did you have Hashimoto's thyroiditis? Why is your body attacking your thyroid, or why is your body attacking your pancreas and causing diabetes? Why is your body attacking your skin and causing psoriasis? Why is your body attacking your gut and causing ulcerative colitis? Why is your body attacking your joints and causing rheumatoid arthritis? Why is your body attacking your joints and why is your body attacking your blood causing lupus, right? So it's just like, I had a lot of profound discoveries. And it's like every medicine that we currently learn about in medical school, and trust me, I learned them all, is all designed to suppress the immune system. Nothing is designed to treat the root cause of what these things are. And I think if you go a step further and you understand the root cause of pain, you can treat it better. If you can understand the root cause of inflammation, which is largely in the gut, for example, I had a patient 2 weeks ago. She came to me. She's like, it was like her 4-month out. She's like, "My boobs are great, doc. Thanks so much. But you cured my rheumatoid arthritis." Because I started her on a gut regimen. Yeah. Taught her about fasting and stuff like that. And she healed her gut. Her flares went down. I'm not saying that's going to work for everybody, but it's just something that us doctors were not taught this. We're brainwashed that we go to this high elevated medical school. And then unless there's a double randomized control study on something, it's bullshit. But that's not true, because it costs $1 million, tens of millions of dollars to run a study on magnesium to treat, pain after surgery, and no one's going to put that kind of money into it because you can't patent magnesium.
Yeah. Yeah.
It's crazy. I'm going on a rant here, but
it's
just
true.
yeah.
It's true. And they need to hear it. People
right.
need, yeah.
And you'll
all
see
need
me
to
on
hear
my
it.
TikTok, you'll see my Instagram, and I go off on these other doctors. I'm like, you guys are drinking the Kool-Aid. This is BS. Like, you need to kind of figure out the root cause of some of these things. And then some people, that's only going to work for them. Like, they just want to take their Synthroid. They want to eat whatever they want, and that's fine. I get it. So it still has its role, but it's just like, if people really want to get to the root cause of what's causing their problems, why isn't the plastic surgeon that's treating your breast augmentation teaching you about your gut health and how that's curing your rheumatoid arthritis? Don't you think a rheumatologist should be able to kind of have that in their armamentarium? I don't know.
Yeah. It's interesting. I mean, sometimes though, people don't want it to be that simple.
Yeah.
I think that's the interesting thing of our society.
Yeah.
Is if you tell someone, maybe if you like cut back your sugar, or if you like, eat less of this.
Well, sugar's also an addiction too.
It is. Yeah.
Yeah. And so that's,
and we don't see it as that, when we're doing it, because we've been programmed. It's, once again, it's a programming. It's like, you get sugar as a reward system, like when it's your birthday, when there's a, celebration, like it's looked at as something that's actually a reward.
Right.
So, we're programmed at early ages that sugar means good.
Yeah.
Sugar is like a treat. And when people are stressed, they turn to sugar.
Mm-hmm.
I think you could go even further on why that's happening physiologically.
Yeah.
But just purely on a mental reward system.
Yeah. I mean, I personally think humans never evolved to eat sugar, maybe random fruits here and there, but like our body actually produces its own sugar. You don't actually need it. I mean, I believe that humans evolved to eat most of a keto-based diet, maybe a little bit of carbs, but it's just like it was seasonal, based on some of the research I did. And if you look at like modern history, the past 10,000 years when we evolved farming and all this other stuff is about, if human evolution is about a year, we're talking about the past 5 hours, right? That's how long we evolved to eat, like from agriculture and everything else. Everything else before that was like hunter-gatherer. Anyway, I'm diving down some other rabbit holes.
No, but it's true though.
Yeah.
We got to kind of go back to our ancestral roots. I think that's something that we often forget. The more simple, the better. That's how I like to kind of live my life now, is because I used, things that just made my life more complicated. It's actually hard work to take 30 pills a day. Like, it's actually harder to take something to alleviate pain that maybe I could go on the treadmill for a little bit and walk instead. That would help me. But, instead it's like the programming to reach for something because you think it's going to take it away. You think it's going to take away the pain. So it's just about trading choices. And this is something I'm going to leave on to Dr. Barrett is, it actually takes discipline to live an unhealthy lifestyle. Now, I know that sounds a little bit more esoteric or,
Oh, I like that. I'm going to write that one down.
Well, it's true. It actually takes, discipline to live an unhealthy lifestyle. So if you can use that discipline towards positive choices, you'll excel. Like, look at where I'm
Yeah.
at today.
Right.
You know, and I still have so much to do here.
Yeah.
But it's like, that was big for me. If I could live that life and like take 30 pills a day and go to hospitals and, you know, live like the life that I was, I can do a healthy life.
Right.
You know, I can switch those choices
Yeah.
and I can just use that discipline for something that's actually going to benefit me.
That's a fantastic way of looking at it. Do you have any advice for someone who has had an addictive pattern in their past, whether it's opiate or something else, and they're thinking about getting surgery, and they're concerned about getting addicted? I have a lot of patients that are concerned about that. Do you have any advice for them?
I would just say to really trust your intuition. You know what's best for you. When you're coming off of pharmaceuticals, or if you've had a prior, you know, history of opioid abuse, I would just be really mindful that, you know, you're a different person now. So it's also trusting that, because I think people go through like a self-trust exercise. I do it with myself a lot. I have to remind myself I'm not the same person anymore. But also just be aware that your sensations you feel in your body, if you really feel like it's not for you, like you don't need to take the pharmaceutical for your surgery, then don't.
Right.
That's how I felt. You know, it's immediate red flag. I could feel it in my body, like,
Right.
don't do it.
Yeah.
And I honored that. And that's so much of getting healthy, is like honoring your intuition. And everybody's different, right? Everybody is so different. You know, there's going to be people watching this that even may not use cannabis as a form of to withdrawal.
Right.
And that's okay, because that's your alert system, like, hey, that's not for me.
Right.
But there is alternatives if you don't want THC, you want just CBD. So it's all about knowing what your body needs, like you were talking about, and kind of tuning into that awareness. But I would just say, really trust yourself, and don't take it too seriously. I think when it comes up, it's a topic, if you've had prior history with it, that, you know, it can be sensitive. And just remind yourself that, you know, this is happening for a purpose, and it's to teach you more lessons and to become more connected to yourself, and to just be very loving and gentle when it comes up.
Amazing. Well, Chanel, I can't thank you for being on enough for being on the show. I feel like we could spend another hour talking. So we'll probably have to rebook you another time, and we'll pick a topic to dive in. But is there anything else you want to share with the audience?
Just that Dr. Barrett is doing things for medicine that I think, you know, so many more doctors, you know, you're doing something very, very special, Dr. Barrett. And, you know, everyone needs to really look at your practice in eyes of understanding, because it's changing how we're thinking about, you know, plastic surgery as well. Like I was saying, there was doctors that were going to prescribe me Valium prior to surgery, after, you know, the opioids, and that was just a part of treatment, and actually thought that if I took CBD, I would have like negative side effects, like we're against it.
Yeah.
And just really leaning into your practice with an open heart and open mind, because there's so much that they can gain, not only from your perspective, but what you've experienced over the years of seeing what you have, like all these experiences you're sharing of, you know, being in these environments where you're being taught something that just doesn't resonate on a level of your soul.
Yeah.
And you're bringing that forward, you know, for all of us. And it takes a lot of courage to do that. So I think people also need to remember that, you know, it takes courage what you're doing.
You know, it does take a little bit of courage, but you know what? I found it being very rewarding when I do step out there, that, you know, if you be yourself and you keep an open mind to these trends that you're noticing, take notice of them, and do step out and say, hey, I'm noticing this is working better, and take the heat, take the criticism, because just if you think that there's a number of people that are criticizing you, there's probably 10 times the number of people that are actually thanking you. So that's been my experience. And so that's my recommendation to other providers out there, that I was just like, okay, if you're listening to this, please just, you know, or patients that have just been thinking one way, you know, just open your eyes to these other alternatives, and see what works for you. And just know that there's a lot of other things out there that traditional medicine doesn't understand, that we didn't learn in medical school, and that are really powerful. So
That was beautifully said.
great.
Thank you.
Janelle, thank you for being on the show.
Thank you, Dr.
All right.
Barrett.